Welcome back to UBV Dental Academy, Leadership in Times of Crisis. As always, Dr. Agatha Biss, and it's a pleasure to introduce Dr. Luciana Arcaro to our panel today. We are going to touch on something extremely important that everybody's speculating on. Rumors are flying around our industry. Nobody really knows the true Hollywood story. The answer: what are the IPAC rules going back into our dental clinics? When are they going to open? And what are the regulations going to look like when they do? I may actually just take a total step back and turn this over to you two to battle it out. And Luciana, we've agreed not to shoot the messenger, but to definitely take everything you have to say to heart. And it's about time we got the true facts out. So thanks for being here.
Yeah, thank you.
Thank you for having me. Well, I have been in dentistry for a few decades, so around the block for a while. Found my love affair with infection control around 4 years or so ago. Have worked with some major DSOs in Canada, the top 4, focusing into development and education to dentists and the teeth. Of course, a few years ago, we had our first strike with public health and dentistry and infection control. That's how we really got into deep and hard into getting some new protocols and policies. It's still a lot of confusion out there, and it's not as a black and white, has a lot of grays and nuances and personal flavors into it. I have, as I said, my love affair with, because I'm a very black and white person, try to read that a lot and understand what is and why we have to do it. IPAC is nothing new. It's just we place it sometimes in the back pocket in place of production. So I'm sorry to say that, but that's true. And so now everyone is awakened. So I'm excited about COVID a little bit, because now I can talk and people can pay attention. We can get some good policies and procedures and protocols back into our lives to protect ourselves, our patients, and our community.
So I guess the main thing is like, first of all, sort of what you know and what's happening around us and what's happening in the different provinces, because I think there's quite a bit of difference across the country, right?
Oh, absolutely. So has been involving in daily changes of landscape for dentistry. So for us right now, we slightly start and open some practices. And as I mentioned, I work with a DSO, so we have been very deeply working into those procedures and protocols and changes. And does vary by province, of course. Aerosols is a big thing that we're talking right now, 120 minutes, 180. Should I just close my practice? What is going to do? How much is this going to cost? We still have a lot to learn. So that is why nothing is set in stone yet. If you look into recommendations, the new norm, no one really knows. I'm not going to give you I don't have a crystal ball and tell you, go out and do this, because there's still a lot of communications. We have to understand that then, at least in Ontario, actually Canada-wise, dentistry will take the direction of public health. Like we're looking into disease and a virus and transmission community. So we have to pay attention into what it is being learned every single day, right? So we still don't know 100%. Can we have a test and look for antibodies and this is it? Like you're free to go into a dental office. Yes, we want to believe in that, but they still don't know if that is true. Can you catch COVID again? So I'm very much into the aspect of looking into what do we have to do right now as infection control in a broader spectrum. That's almost to take COVID aside and think what infection control is. Infection control, it is a prevention of a broader spectrum of diseases. We're still out there. We still have measles, who's coming back, 158 cases last year. We still have TB. We still have chicken pox. We still have hepatitis, HIV. So looking into what we're gonna do it, then will protect us as a broader aspect and part of infection control. So we're looking into it. It is every patient is a potential hosted of a disease. So if you apply that, it helps you to understand how I should be running my practice into COVID and future too. How we're gonna land it, we still don't know. Ontario is 180 minutes between patients for emergency. And we have Saskatchewan who's 120. Alberta did not really set any stages into it. We have into Nova Scotia, it is pretty much only 8 offices who can open right now, which is based on oral surgery settings. So we're still very much into a dance to where we're gonna land it. Has every province and has a regulatory body. So we're still taking a lot of conversations with public health at the moment.
So some of these offices that are open currently, and they have to wait, the 180 minutes between patients, not to sound, like an ass, but why even open?
It is a demand there. Like we have been, as organization, quite busy into, unfortunately, our dentistry, and that's a personal view, has not been the best in the first thing in our patient's mind, right? So my hair appointment became first and foremost more important than my dental hygiene appointment. Mm-hmm. So as patients, a lot of times we ask for a treatment plan, a present that is $5,000. Mm-hmm. And then they go, oh, I don't have $5,000 for my dentistry, but I have $5,000 for my pair of shoes in my purse. Yeah. Right? I'm a girl, I like shoes in purse. So I don't know, maybe a car, I don't know for you, Mark, what do you want to do it? But cigars and cognac, maybe.
Ah, you got it.
Yeah, you got me. Nailed it.
There we go. So now we're having a few months of already years of neglect. So we are seeing actually quite a bit of patients with required like RCTs, treatments and falling crowns and everything else into it. So we had to be able to adapt into that aspect of it and how we're going to be doing, how we have been doing. We have extended hours. So 7 days a week, and you're going to do some extra shifts into it to be able to accommodate. So that is really going to be potentially what a dentistry seems to going to be landing.
Now, is this a like a short-term thing into a new future, or do you see this becoming fairly permanent?
Until we understand COVID, it will be probably the new step to normalcy. You look at Lagos now, right? They are giving masks. They're obligating everyone to wear a mask as they come in. So I do believe we are going to become a society. Then dentistry will be a little bit as when I was a child. I'm not going to age anyone else, but you were one patient at a time, and you go in and you sit with the patient, the doctor. He closes the door, right? Like we went out of that more old-fashioned dentistry into a more open concept. The patient is more educated, a high volume production. That creates for us as environment cleaning a challenge at this point. Until we understand COVID, I can see public health taking a little bit of a step into it because we're just flattening the curve, right? Like as we open up, it's not going to be going away. I think that's the understanding. What a flatten the curve it is allow our systems to handle the numbers of patients coming into the system.
What are some of the rumors that you can dispel? Because we're hearing all sorts of different perceptions on this, and there's a lot of argument on how we're actually going to be able to survive. Is there any rumors you're hearing right now or anything that you can dispel and put fact to?
So definitely we're going to look into emergency setting for a long time. We are looking into the colleges are trying to find a compromise into what is dentistry, what is medical, and what it is required. So like we're a little bit has in the beginning of the infection control bust of a few years ago, right? Like as the first time that the public health went out, they went into a standard of a medical setting. And then we had a lot of practices closing a few years ago, right around 4 years ago or so. Then the college finally worked with the public health and go, okay, we're different. You cannot make us work as a hospital setting. And I think we're right now in the same spot. How can we do dentistry into the dental level, not in a hospital setting standards. And all the boards are communicating a lot and speaking a lot with public health to find the happy medium. So our CDSO is suggested, even for us as organization, do not invest in major infrastructure changes. Wait and see in very large equipments. I know everybody's going around and saying about these filters and everything, but it's a bigger picture. It's not just placing walls. On those walls, can I have filter systems? So I'm gonna have to have negative air. Then if you place the walls, what is their square footage? How many units are gonna be buying? So you needed to also think in a long term, it's not just placing walls and a door. Now, if I'm gonna need it to do filtration system, was better have it open bay, or was better to now have small little units all around, or how I'm gonna connect to the airflow. So it is a more complex answer because each practice is unique. So you're gonna have to have testing. So it's not just buy a filtration system. I have to prove that the filtration system fits and functions to the airflow and the square footage of my practice. So it's not go to Amazon and buy something, right? We needed to understand that then everything that is going around has consequences and has a step of a workflow, including into your investment into it, right? So infrastructure, layout, if you're gonna need a door, do you have a door who is wheelchair accessible? Now, how am I gonna open the door? When I open the door, I'm gonna hit someone walking the hallway, health and safety. So we can go in and kind of spin those conversations a lot. So just myself personally, wait. You know, they are gonna give us enough time ahead, leeway to open up as you require. Can be very expensive, right? So where you want to spend your funds, I would be more careful into it.
Wow, it's I don't know about you, but as an operator and somebody who's going to be opening your clinic probably within the next 60 to 90 days, is there anything you can tell, Luciana, to a doctor in Ontario, what can they do to be at least prepared so that they can be efficient and effective? Because it sounds like there's literally a rope around our industry's neck on how they're actually going to make production.
So I think it is, first thing it is, looking into infection control has procedure base, okay? So take one step back and take it granularly. So in a granular level, what are procedures I can do it that aerosols creating or non-aerosol creating? So really have one step back and look at your operations. So who do I use to do, what materials do I use? What techniques am I applying? Can I do this in a different way? Because the 180 minutes is only for aerosol creating, right? So let's look at it.
I don't mean to interrupt, but like, isn't everything we do aerosol produce? I'm really stuck on what is non-aerosol producing. I mean, my teledentistry, you know, my phone call is non-aerosol. Even an x-ray, could not even take an x-ray. So what is the point of even opening up if all we're doing is writing prescriptions? I mean, I can do that now.
That is one part of it, introducing teledentistry. How much can I do remotely? That is the first one you want to open, right? Can I do quadrants a time, right? Like how I can make it the best of technology that I have. Then the patient comes in and I can have longer appointment times with the patient, and there would be less PPE being used because the cost of PPE also has been increased, right, to everyone. We're talking about a code, then there will be developed an extra line on your cost and fees and treatment planning, development, and potentially some of our insurances are looking into covering that fee. So you're looking into more, how can I exactly work my workflow from every single procedure, what a type of PPE I'm gonna need to use, what a type of prevention, and the workflow of that appointment. What I'm gonna need to have into my room, because right now, if you walk it into a room with like you will place your PPE in a clean area, the moment that you have to leave the room, you have to remove your PPE at the point of your appointment. So let's say you need something else, you're gonna need it to, your assistant will need it to doff. Like,
wow.
So it makes, if you really start to take it, it's,
Wow.
yes.
What's the additional cost on that? Has that been factored in just in general terms per patient? What's in the new cost with this
Well,
PPE?
it depends on whether or not we have to start building walls and redoing our offices, right? Because if you're just talking gowning up, gowning down, the cost will be significantly lower than if I have to restructure my entire framework of my office and add doors and add this and add that and changing rooms. Like, you know, the cost could be anywhere from minimal to massive.
Yeah. Like
The other thing that I'm, you know, like in talking with different dentists about this, there's kind of two little taboo things that are coming out of this. And I want to know if there's anything that you're hearing, Luciana, because what couple of comments I've had where people are like, well, who's going to make sure that I am taking 3 hours in between patients? Like, I'm just going to, you know, cut down the time to whatever. So there's the cheating aspect, right, of not following through. And how is that going to be checked or implemented or made sure it's happening? And the other one is what's going to happen inadvertently, and this is what I worry about, is that we're preferentially going to take the patients who are willing to spend more money in our offices. So we're no longer going to say, if I can only see 3 people in a day or 2 people in a day, how much are you willing to spend to take that appointment? And that's what this is creating, right? Is that something that you're seeing?
Oh, absolutely. So who is going to be watching? The big brother watch is public health. Okay, so in Ontario, you have a very good presence of public health.
Yeah.
There are 34 different bodies and regions to it. They come in, they have the right to shut you down at the moment of the stop to work order. Okay, if they do a stop work order, depending off of their finding, your name will be released to the media, will be posted into their website, and you potentially can lose your license.
So see, that's good to know because a lot of people don't realize the consequences of doing this. So when I hear this, it's just like, you know, you don't want to do it ethically and morally, but you also don't want to do it because the consequences are massive.
It is, because it is very important. That is for any IPAC, not just COVID, okay?
Yeah.
So any step of your infection control procedures and protocols, we have 2 standards in Ontario. Then we have to follow, what is your RCDSO and your public health.
Yeah.
Your public health standards are higher than our CDSO, and they can trump our CDSO. So let's be very clear. They have the rights to come in, and you don't have the right to deny the entrance. The moment that they come in, they will turn your office upside down to the aspect of they will open drawers, they will look for your logs, they will ask questions to every single staff member separately. They will ask questions. I had a couple walkthroughs with them. It will take 2 to 3 hours, and it is not a nice environment if you're able to be there. Now, if your front desk is there, the only person there, she's going to be the one responding for all those questions, and it's better she knows, because if they don't know how to answer, she will be the one. They're going to be based on the information of their findings, their logs, and the answers. So you really have to look into right now. What I would say is really making sure, thinking about your procedure base. Infection controls, it is based on procedure. So look into granularly how you're going to be doing it, how you're going to implement it. Invested into how I'm going to be doing my patient screening, right? We already had the risk assessment patient screening previously, COVID, but now it's even more important. So having has the simple concept of having your stop sign, right? Stop, are you feeling any fever, cough, and all the other questions, your hand sanitizer, your masks. Have that is actually a passive screening. We needed to even do pre-arrival, right? So when we're gonna come back, we're not gonna be using text messages and messages to, we're welcome back. No, you're gonna call. You should be calling every single patient and say, hey, how are you doing? I hope you have been doing well. We're happy and excited to have you back. There are a few changes. What are the few changes, you know? I like to say no more field trips to the dentist. So it's not everyone coming to the dentist. It's gonna be your patient. If they need a guardian or a chaperone, then they need to understand they also gonna be screening. They are both a part of that. So we wanna making sure they understand the temperature will be taken. They're gonna be responsible to answer a questionnaire of a COVID. They're gonna be able to sign You're gonna have to wear a mask. You're gonna have to have your hand sanitizer. You're gonna have, so that conversation needs to have. So have a little script, how you wanna present those changes to your patient. Are you choosing to be cashless, right? Are you gonna just be taking debit or Visa? You need to let your patient base know. So how can you do that? Is in a better form, not just a very dry email. Call them, how you're doing. Use this downtime to connect with your patients and say, we're excited. We've always been proud of our infection controls, but now we want to share with you what we have been doing while we're downtime, right? Your things have changed a little bit. This is what we expect for you to do.
Is there, Luciana, is there going to be a COVID handbook that comes out with a step-by-step, every requirement needed so that, yeah, I know we're talking to one right now.
It's all here.
Tell us, Ciano. But is it, like, I know I've been through this before with offices, and you have too, where just on a regular infection control and having public health come in can be pretty damning and devastating. Even when people think they're up to standard, is there going to be an actual document that comes out that says A to Z, here's what your office needs to look like and the procedures you need to follow to be compliant?
So right now we already have the standards of a public health, right? So they do come out with a lot of information. So if you are not familiar with the Public Health Ontario or your regular public health, that should be your best friend right now. They do have updates, they have posters, they have job aids, they have frequent questions. It should be your best friend. Like it is truly right then, always become very familiar. In Ontario, they have 2 courses that you can take for free, 2 modules, which is the reprocessing module and the IPAC conference. That is good for everyone to be taking. You should be taking yearly, it's free, print it and place it into your IPAC binder, because that is what it is actually required part of your audit. Other thing that you're supposed to be doing is by taking those courses, go in, download your infection control checklist. So what are you gonna be checked upon? So how do your audit? Going in and audit yourself. Look into what do I have? Have I understood what the step it is? Have Zoom meetings like it is with your team and bring them to a part. Your front desk, your director of first impressions, your treatment coordinator, they're gonna be asked. The first thing that happens when they pick it up the phone, what you're doing. Your patient knows what a PPE is right now. Your patient knows what it is, hand sanitizer. They know sterilization, disinfection. They are now Google smart. And so, right? So we need to making sure that the person who's answering the phone understand the whole step into from the front desk all the way to the clinical setting, what we're doing to make sure you're safe. We need to make sure our patients are feeling that we're doing everything. So we have that. So downtime now, get it up with your infection controls, because to be honest, a lot of was made into the COVID line of viruses. So a lot of it is based and will support what we need to do into infection and environmental control. We look into risk assessment, teaches you risk assessment. And that is the magical word into what we're looking into it. Our patients coming in, you're looking at the phone, you're gonna do a risk assessment. Can this patient come in? Your RCDSOs, all your colleges, that's your other best friend. Place it into your favorites, check it every 2-3 days. They are sending updates all the time. And they're telling you what the landscape will look like. CDC, also a great one. Right now, they told us how we can reuse guys to be able to extend the life of an N95, right? So, because it is a concern for everyone. Feeding tests, they have all that information. So all your colleges, all your associations, and your public health are the 3 areas that you should be looking in a weekly basis. If you can do, it truly is changing every second day. Like I'm there and like I'm writing a training day 2, like, okay, let's rewrite to this page, because the things are really changing, and infection control is not going to stop changing. That's one thing too, everyone has to realize. COVID will go, but something else will come. We needed to making sure that it's a living, breathing, that we needed to keep training, keeping auditing ourselves. We're humans. We're gonna go back a little bit. We wanna relax. We're gonna try to cheat the system. Myself, I don't want to be the practice who gets in the news because I had 5 cases of COVID. Have a strong protocol, have a strong pandemic policy. Take the guidelines from public health, take the guidelines that we have from your local college and develop those policies and speak with your team. Start to them. They're the best sometimes consultants because they understand their struggles and how we're gonna do it, the time to take for sterilize. PPE is as good as the moment you're wearing it. If you don't remove them properly, if you don't do your environmental cleaning, if you didn't do your pre-screening, PPE will take you so far. So we needed to think in a broader spectrum of exactly workflow and how I'm gonna making sure that my environment is clean and safe for the next patient and more for myself and for my team to be around.
Wow.
I know I'm not helping much.
We're heading towards the bold new world, the brave and crazy new world.
It is, will be challenging, can be expensive. I think your team needs to, going into offices before is still a lot of confusion on the basic aspect of infection controls. I think it's important to understand that. It's important to understand how to properly screen your patients. I think our patients will be a little bit more open to, tell the truth and not come in and that in concern. So it's exciting for that. I think we're gonna have a more honest conversation with our patients. And when we are presenting our treatments, presenting to, this is what we can do, the best way for both of us in regards to treatment, we can do a quadrant instead of bringing you 3-4 times. So your exposure into aerosols, into the environment, into everything else also minimizes, right? So try to find a way to explain it's not just about the money, but it's also a best approach. I can get you in and we can do a lot more in one setting for you. And that's the new recommendations. That is the new norm that we can do for you.
I feel for every dentist that's listening to this right now, to be honest with you.
I know. It is tough. It's a new world, right? Like it is, if you can think very granularly, it will be difficult. It is overwhelming. So you have to, I think the most that we can do right now and what we have been doing in our practices, it is think procedure-based. It's not patient-based. Like infection control should not be patient-based, should be procedure-based. And what we can do to maximize the time that we have with our patients and how I can minimize the amount of PPE exchanges, your environment, cleaning, how can I do that properly? Do you have your logs? Do you have a plan? If someone goes to the bathroom, they have to clean that environment after, right? So we have a few things that we needed to understand the products that we're using, understand the level of PPE. Like it's surprising how much people did not know about a surgical mask having 3 levels, right? Our teams are still, we all need to learn about infection control. And I think the more you have knowledge, calmer your team will be. So we, in our situation right now, we investing a lot of times talking about infection controls. We did education about PPE into our team. So we spoke about what is flatten the curve means, what is potentially the new norm is going to look, hygiene is not going to go back so quickly. It's probably potentially the last phase of opening because of how you're going to do it, right? Like if I have to change all my PPE every time I leave the room.
Yeah.
As a doctor, how are you going to do it?
A simple, not a simple solution, but a simple shift would be to basically attach that hygiene appointment to another appointment. So basically, if you're coming in for something, you're getting your teeth done with my hygienist because we're not switching in and out and doing all this stuff. We're just going to use the one room for everything that you need done. I feel like though, one thing that I find is different for dentistry that's different for any other medical profession. Dentists are already seen by society in a negative way, right? We have this negative connotation for many reasons. And try and tell one of your non-dental friends that you had a bad day. You can't do that, right? Because people go, oh, you're just rolling in money. Like there's this this giant misconception of what dentists do and, you know, how much they make and how easy their life is and how little overhead there is. And what I worry about is that no one has our back to come to the public and say, these are the new concerns, these are the new issues, your dentists will all be faced with these. And hey, public, we need you to understand that the cost of dentistry will escalate because this is so expensive to implement. What's happening is that no one is doing that for us the way, say, a hospital or say in medicine, it would be taken care of by their governing body. It would be taken care by, you know, whether it's Ministry of Health or something like that. It would be like, yes, your visit now to a hospital, for example, will have a copay. You'll have to, you know, whatever it would be, it wouldn't be down to the doctor that you're seeing to say, hey, patient, now let me call you in person and say, by the way, I have to charge you even more than I have in the past, even though you already thought I was overcharging. Now I'm going to overcharge you more. It would be the hospitals and the news and the you know, the public would be informed that the reason the price is going up is because of this. I just feel like no one ever has our back, and that's the one thing that I would love to get the message out to, you know, everybody out there, is that whatever has to happen as a result, we're not doing this to make more money. In fact, I have a feeling that dentistry in general will be, you know, a long way now to really get there to a point where we're comfortable again. And yeah, I just feel like our governing body and our, you know, Ministry of Health and the news and our government officials would say, this is going to impact the prices because we're changing the rules, not because the dentists are greedy.
Yeah, no, it is. It is dentistry always been saying, right? Like that's why we use our team to speak with our patients, right? Because then it's not they feel it's coming from a different level than the dentist, right? And then if you get into the same message from the front desk, from the hygienist, from the assistant, and from you, then they will listen, right? So it is challenging because we definitely come last into, unfortunately, a lot of our patients' priorities or understanding how the mouth is connected to the body and you do have side effects if you neglect that. What we can say, and that was part of actually the other webinar that I was just in, it is like, how can we as organizations, as dental industry, get together and really ask for that message, ask for our associations, our college to say, we understand the price of PPE, as you asked, Mark. I don't know, like right now it's crazy. Like we're looking into buy, so as you both know that I own a company that does dental supplies, and the amount of what they're asking for a gown, I used to pay 3 cents for a gown. They're asking me $9.55 a gown US plus tax and shipping and everything else. Wow. One box of gown is $292 US. Price for me to buy right now with 100 gowns. I refuse to it. Like, because anyone will see that I'm gouging, right? Like, because I have to pass that cost around. And your N95s, you used to pay $18 for 12. Now you buy one for $8, $9. And it is difficult for us to do it. So how much it's gonna cost for each patient? I'm terrified right now because it's gonna be, if you have to change your face, like your face mask, your shield, sorry, your masks, your gowns, your everything else, your gloves, your flippity, your whole environment with barriers, we're looking to $20 plus.
Yeah.
In a good environment. Right now, it's costing you a lot more because one gown is costing you $8. One mask is costing you $8, and you still have everything else. So your overhead just went. Like, you cannot even compare how to even think how to do dentistry, right? So it has to settle. Absolutely, that demand of will come down. Hopefully, it will balance it into dentistry, but we're still gonna need it to pass it to our patients. It is important for our organizations to really go into and put ourselves together and say, look, it's not the dentist, it's not the industry being greedy. If you have experience yourself into buying, even your groceries are going higher, right? Like you're looking into, if we're gonna look into our meat supplies with those two plants, of course, the supply and demand is gonna go, prices will hike into food and supply. So why does that not apply to dentistry? Our patients don't think of that, right? Like they don't connect dentistry to our everyday life. So if we can do that, that will be the ideal. If that doesn't happen, then connect with your patients in social media into a nice message and into a nice way to COVID has brought, like do a little vignette, a little clip, something that will have the buy-in and the trust of your patients. Then if it is, I would not say the fees went up, but plant the seed into how incredible, we're ready for you, we're excited. Is this what it's gonna look like? So if you have maybe like a lot of children, like, you know, the ninja look that you might see into your practice, like have some fun with what is coming to connect with your patients so they're ready, like they're not feeling you're just open up to take my money because I'm in pain and I need to see you, right? Like the negativity, then potentially our patients will feel when this is the bottom line of an extra code with your prices. We spoke about our organization too. Should we add into the fee guide, like above just the fee and hiding there is sometimes is difficult because if you are, your patient, it is insurance driven, the insurance may not cover. So then they're gonna question why the prices went up anyways, right? So be upfront, but try to make it a positive spin into your social media presence, into how you're doing dentistry, how things have changed, and try to avoid say the cost of it, but do something, you know, that connects to them in a personal level. If I know it's my safety, I will pay more, right? Like we all do. If we bond and understand that is for your own safety, we're willing to go and pay a little bit more. So I think we needed to, it's part of that continued education that we struggle with our patients, right? Then dentistry is important and your safety it is, and that comes with a cost. It is the dance of dentistry, unfortunately.
Not a fun, you don't have the job of delivering a hearty, fun message every day. I feel for you, but this is the reality of where we're at right now. Is there something, if we were going to end on optimistic note, I know you don't have a crystal ball, but if you're going to forecast into the future, what's something that we can look forward to in our industry to see that there is a positive spin, there's something at the end of the rainbow?
I think it is open up us to think of a technology and helps us to think of a change our workflow, reinvent ourselves. I do believe that in dentistry sometimes we still run in a very old model and we slightly struggle to implement new things. Technology in the last 10 years for dentistry has been so exciting, and at the same time underutilized into our everyday practices. So imagine being able to use that scanner more often, who has been dusting on the side of your room instead of sending impressions, right? So less footprint of going back and forth, less patients appointments. Now you have the milling machine that you stop using, you use when you're excited and then kind of went down to it. So look into more how you can use technology to reinvent yourself and your workflow. Look into what are your team talents are that can really bring that up into, you know, patient screening, connection, your case of presentations. How can we use technology so they're coming less back in? I think teledentistry is phenomenal, like hopefully stays, because that's the way we communicate, right, visually into it. So I think it is as much as the fear of the unknown, we have enough tools that we can reinvent ourselves right now into our practices. We're just so used to go back to the norm. So be flexible and be open-minded, think creatively. You know, you're always smart, so you're in dentistry, so you definitely have what it takes to it. Talk with your team, how they could do things different, then would cut down the amount of appointments workflow, right? Sometimes we do bring patients back because we're more comfortable into the old setting. So how can step up my own game into challenge myself to do appointments in a more cohesive way, in a more productive way with the new workflow. So I think it is exciting. As much as is scary with the fees and everything else, we do have enough tools and technology in our hands that can help us, change and move things around to 2020 COVID.
Question for you. I just had an idea. If I have a family that live in the same house and they want an appointment one after another, do I still have to wait the 3 hours in between when they're in the same household?
Great question. That is actually a very good question. I need to reflect on that. They have this I breathing the same air.
Stop the IPAC. Stop the IPAC.
Well, but think about it. I mean,
let me breathe a little bit, because
no,
that's why it's family dentistry, man, for real. Now.
There you go.
Family
and that's a good point. That's a good public health question, actually. That is something that we should investigate. Because
I mean, how cool would an incentive be that, hey, bring your whole family and you're done, and then we don't see you for however long, right?
Mm-hmm. And then even the yearly checkup, right? Like change of dentistry, then you come in and you do a full 1 hour. You sit with your patient, do your whole treatment planning, and doing blocks. So that's a lot of things you can do. But I like that idea. I'm gonna check with public health, and I will let you know. My God, the new thread going on.
I got lots of ideas, Luciana. You just leave it to me.
Awesome.
Dr. Disruptor over there,
Oh yeah.
No, that is great. But it's true. If you think it off of that, like if you apply the concept of in the same family hold, you can stay together and doing things, it makes sense. Into a logical aspect, we have to look into cutting down into the infection control aspect, but I can see potentially working.
No. Always full of ideas.
Oh, yeah.
Agatha, now that you've stirred the pot, do you have any final words to close this out on behalf of the doctor?
Yes, I have a couple of things. So, oh man, now you made me lose my train of thought. So we're watching Botched at home. You know the show Botched?
Yes.
So the whole time, because you're such a sweetheart, Luciana, but like the reality is when you say this nice stuff, I'm thinking not everyone is like you. So let me give you an example. You're like, oh, our patients will understand the increased cost, and you're talking about safety, and you're saying, oh, well, if I know I'm safe, then I will pay more. You got to watch the show. If you were right, there would be no botch. People, these idiots are getting these surgeries done for the lowest cost. They're calling around. They're going to crazy different countries, sticking stuff in their bodies that doesn't belong. And
I'm Brazilian, I know.
Yeah, paying a fraction. I mean, I get these patients all the time. They fly to Europe I'm not even going to mention the country because I don't want to piss anyone off, but they're getting stuff done for a fraction of what it costs here. And then a year later, I'm ripping it all out. Like I have so many cases that are full mouth or full arch because something was done over there and now we're pulling it off 6 months later. So the reality is that if somebody's willing to do that, and this is typical phone calls. How much is your crown?
Mm-hmm.
Well, so, and they call 10 different offices and they go to the lowest price. So is this going to be a new norm? How much is your PPE? And let's go to the lowest price. That's my fear around this kind of stuff as well.
Oh, it will, but then I'm going to challenge you. Is that really the type of patient you want to have in your
no, 100%. We don't even, like, those questions don't even get to me. Like, everybody here knows. But this will be an issue, and people are going to be questioning the fees and questioning the prices. And the reality is that you get what you pay for. And I don't think human beings will ever really learn that lesson. This will be a whole new test of it for sure, 100%, because we're all going to have to raise our fees. I know I will. I hope most dentists will in order to stay alive. I mean, you can't do this and not make a living. So even if you take a cut on your living, you still have to actually make money. So these 3-hour wait times, what is that equate to in terms of the cost of that one appointment? It's going to be in the thousands.
I think it's going to follow a little bit into when we start paying for plastic bags, right? Like we all kind of went, okay, then I don't know if everyone knows, but the plastic bag cost actually was removed and we're still paying for the 5% of plastic bags and we have done nothing. And I'm the first one who doesn't bring plastic bags, right? So it becomes the new norm. Like people will always find something, right? Like we're always gonna find our patients who's gonna complain about something, and that's human behavior. We do that into every sector into our lives. But I think it will become then the new norm, right? Like we know that we are paying for plastic bags, which is not a law anymore, but no one stops shopping at the locations, right? So it is just that. It's going to be that adjustment. So train your team to handle those patients, to not take personally, to still kill with kindness. And you know what?
I knew how to do that.
I mastered that.
Luciana.
Just how to do that.
Luciana, I know
Luciana.
You've been the voice of IPAC. You've been the voice of reason. You've brought a lot of valuable information today. It's upsetting, but I think you're right. This is going to be the new normal. We keep overusing that statement, but that's just the way it is. And we will adjust and we will thrive and we'll survive in the future. And I think the only thing we can do is segue into what are Brazilians putting in their body for the next show.
Oh,
Otherwise,
you don't want to know.
You know what? It's probably best to go on that note, leaving that question to people's minds. But thank you for your time today. It's great.
Thank you.
Yeah, thank you both. Off the record, what do you want to know? I have a lot of paperwork and I can tell you.
I bet. I don't, I don't envy your job, but then I should be looking in the mirror when I say that. So
you really need to change your backgrounds, annoying.
Right? Thank you. We're already
Really annoying.
It looks like
You know
it's
what?
a thing hanging
I
out.
know that. It's like Copacabana.
Listen, I've never told anyone to for the first 30 seconds.
I'm still feeling my bruises from this morning. Be gentle.